Alright, so today we're going to do some manual therapy for turf toe. Turf toe is essentially a forced hyperextension of our great toe, which is commonly seen in basketball and also all our turf sports of football and soccer. What we're going to do is patients typically will have pain back into extension. So one, we want to kind of habituate or regain some extension or have them feel better going into extension, but also do some techniques just to loosen up that toe, because what essentially is happening is getting forced and locked and loaded in there, and it's kind of jammed up the joint a little bit. So we're going to do some techniques to loosen that up. So based on the kinematics of what happens into extension of the toe, the metatarsal is staying fixed, and we are just moving the great toe in what we call an AP direction. So we were going to block the metatarsal here, which is our first array, and then what we're going to do is just put a little distraction, and then we're going to push one down, and then just try and gradually regain some extension over time. As long as they're okay with putting the thumb, do that. If not, try and use like your web space so it's not so pinchy, and you should feel some movement with that. Sometimes a general distraction force where you're blocking, again holding that first ray and just distracting and pulling the joint out a little bit has also been beneficial. Sometimes also working the opposite. Again, their pain is specific, so you want to kind of feel what works best for them, is going into flexion. So sometimes just resisting extension for a time, letting that rest a little bit, will give them the best response. So sometimes we'll go in the opposite direction and do what we call a posterior to anterior glide into flexion, and now we're going in almost the reverse. Also, some manipulations have been known to be beneficial. So this is kind of like a finger grip or alligator kind of grip kind of pose. You go in and just doing a distraction force, and then you can also play around with this and also throw into a little flexion as well, so you can just play around and see what works for the client. Keep your manual therapy pain-free, because that's how it should be, and that way the patient keeps coming back and you can keep working, building off the top of that. And that's about it. And if you have any questions or anything, feel free to reach out to us.